I like to think that the message is getting out there, that words do matter. Many new publications have been put out into the public space and in the scientific research on how the nocebo effect is generated from patient-provider interactions. And there are some really important things to read about how our words, which we as clinicians might consider really innocuous, could in fact directly influence somebody's experience of pain and change the way they think about their bodies or their capacity to move or engage in things, and certainly their future. I do see some change in my direct sphere. I have directly noticed, for example, that people referring patients to my clinic, in referral language, they always have a reason for the referral, and there are now increased numbers of referrals saying something like, please help the patient with beliefs and fear avoidance and could benefit from some pain neuroscience education, for example. And they might say the diagnostic code associated with the referral is low back pain, but the reason for the referral is they're afraid to move and they need to be coached and guided into getting more active, for example. Whereas before it was diagnosis, chronic low back pain or idiopathic low back pain, needs core stabilization. Right? And just that language suggests that they have a stability problem, and that by itself can lead to fear, avoidance, and worry in a patient. Metaphors are a really effective way to help people understand complex issues, and pain is always complex and always will be. This is why it's difficult to treat. When you're trying to explain a treatment intervention or a recommendation or help somebody understand why they hurt, metaphors are a really good way to communicate something that otherwise would be hard to grasp. And something as simple to a clinician as stenosis. That word stenosis has a negative association with it, especially if you look up what that means online. Anatomical pictures can be scary. People use language interchangeable with stenosis like pinched nerves or narrowing of the canals, and that evokes an image that can be really frightening, especially when you hurt. So I use a metaphor to help patients understand why it is possible for a large number of people to have stenosis or degenerative disc disease or degenerative joint disease of other types and have no pain, why those things coexist. Well, it's because our bodies are adaptable and because we can adjust. Our nerves can adjust to smaller and smaller houses. And that's a metaphor I use to describe stenosis. It's no different if you choose to move from a large house to a small house. If you do it in stages, you adjust to each stage, and once you get to the tiny house, you're fine. If you move directly from one place to another and you have to suddenly get adjusted to a smaller space, it's harder. And nerves have that problem too. So if there is traumatic injury and there's a sudden change in the internal space for a nerve, it's going to tell you about it. It'll hurt, or you'll feel pain. And by contrast, if that process happens slow and steady, the nerve is fine and it can adjust. Now, what changes suddenly when there is no injury or there's no real good mechanism for a sudden change in the space for the nerves, often what we see is the highest likelihood that someone will develop an episode of severe back pain is during a transitional phase in life, when you're either changing jobs or have a new baby or someone dies that you love or some other major life transition. That's when people have back pain episodes. And then they get a scan because they're scared and it hurts a lot, and the scan shows tiny houses for nerves. And now suddenly that's the cause of the pain, or that's how it's labeled. When really those nerves were happy in those little houses all along, and the situation caused body chemistry changes, muscle tension changes, sleep disorder probably. And all of those factors can definitely cause infiltration of inflammatory mediators, changes in your immune function, so you have more propagation of pro-inflammatory cytokines, which are not helpful, and cause compression on nerves. And so that's usually the cause of back pain, and we blame the tiny house.